All right. So if you are part of our PMH 30 Days Walk to Success, you'll be receiving an email from me today. For modules 1, 2, 3, 4, and 5, you get a PDF. They are important. For module 6, which is our crash course review, you do not get a PDF. Okay. However, I am going to send you a PDF anyways. But please, the reason why you don't get a PDF is because I want you to write it down. Okay. Write it down all the information because every single example there is important. Okay. Every single example of the crash course review, every labs or every medication that I mentioned, you should really, really know. And for that reason, I don't like to give it a PDF. But I understand that some people are testing next week and they may just want to fastly, very fast answer the questions and kind of answer the content, right? So I'm gonna give you a PDF, but don't use this PDF as your crutch. I really want you to stop, think, write the content, analyze it, so that way you're not just like reading and be like, oh yeah, I know this, and then you get a question and you get confused. Okay, I'm going to give it to you so you can use it as a fast resource before the test, but you should still write it down the information every time for yourself, so that way you are good to go. Remember, the best time to prepare is right now. If you have 3 months before the test, great. 2 months is great. 1 month, you can do it. Less than a month, you really cutting close. It doesn't mean that you cannot do it. You can still. I have seen people that have taken this course in 7 days and been able to pass because they had all the time to study for 7 days. Since everything is recorded and available, you can do that super fast. Okay. So, but ideally, a little bit of time will be more beneficial to you. If you have 6 months from graduation, even better, right? How long do you have to complete the course? As long as you need. I don't put a limit on what you should or should not do. I give you all the support you need. As long as you need it, I'll be there for you. All right, we are about to get started. Remember, you only have 1 minute per question. Answer on your phone, look on the screen, and good luck, everyone. Let's see who's going to win today's event. Wow, phenomenal, right? So the recovery model is a model that's individualized and is set um by ups and downs, right? Recovery is not a skyrocket to the moon to success. There is ups and downs and is individualized. Is made for the person. For that reason, self-directed change that's individualized for every person is the broad answer that fits this question very well. Okay. Good job there. So the person that answered faster was T there, and she's taking the lead. Next question. This is an accept question. Watch out for accept question. All right, we have 26 seconds. All right, we have 6 seconds. Pick your answer. Fantastic. Fantastic. Somebody unmute your mic and tell me a few things about Geodon. Anything that comes to mind.
It's one of the Zell medications. It's got a low risk, one lower risk for metabolic syndrome.
Okay, great. Anybody else? Give me a fact about Geodon.
You have to take it with food.
Perfect. Take it with the food. It's part of the skinny meds. What are the skinny meds? Give me a name. You know, the those that are least likely to cause metabolic
Abilify, Geodon, and Lorazepam.
and acenopine. Yes, but those are the best. Which medication is actually unmute yourself there for a second. Which mood stabilizer is the least likely to cause weight gain?
Lamictal.
Lamictal. Okay, very good. What are the things that you have to do before you prescribe a antipsychotic? What do you do?
Ways to
lab. Lipid panel,
Lipid panel,
family
ways to his the circumference, right?
family history of
Okay.
cardiac.
Okay. Pregnancy test, very important. In fact, any answer that has a pregnancy test, it should go to your strategy bucket, right? Because pregnancy test is so very important and it's part of the patient safety. Okay. If you come across a question that you don't know the answer, but it has a pregnancy test, it could be likely the answer because it's high yield pregnancy test as an answer. Okay. All right, let's move on. All right. So we got Becca taking the lead here now. Answer fast to get the most points. All right, you have 20 seconds.
I can't tap on my choices. I don't know where they are.
On your phone.
No, I did earlier, but since
Oh,
somehow your video is all over the screen, so I can't choose an answer.
okay. No problem. Try the next one. They may reset. So, yes, when you have someone with autism spectrum disorder, right? They may not act like other kids. When you call, hey, John, and John doesn't look at you, there may be a sign of autism disorder because he just can't. When he line up things in a particular way that no one can never mess it up, that may be a sign of autism disorder. For example, they are I don't have a class, but I participate in a class with autism disorder, and I seen this live, and it was so interesting. Last Friday, he was calling the teacher all kinds of names and was not listening at all. As far, I mean, he was able to speak derogatory terms to the teacher. Yet when she said, "You are now on your timeout and you cannot use your computer," and she's like, "Okay, Miss, blah blah blah." Right? Why? They like orders. The things have to be systematic. You cannot change overnight. And that's, he was able to speak his mind, but when the order was given, he listened right away. Right? So they like order, systematic things. Now, can anyone tell me about the mirror syndrome? What the theory? What is it like?
Broken mirror theory
Mm-hmm. What is it?
that the
Yes,
neuro,
mirror neurons.
mirror neurons were, I don't know.
They are not. So in our cells that don't have autism disorder, we are able to heal social events and then kind of get the, they're the cue of what's happening. If I have an interview and the person says, "Well, it was nice to meet you and I'll see you next time," then I know that the interview ends. I had a patient with autism and they said, "Hey, it was great to meet you. I hope that I can help you overcome these conditions. I'll see you next time." And he blankly stared at me and did not even stand up, right? So they are, when you have the broken mirror, it means that they are unable to get on social cues that we otherwise would. Okay, and that's a theory that may, in the test, if that shows up, it most likely is the answer. In real life, it's kind of like not a lot of people support that, but for the test, maybe the right answer. All right, so
For the lady having trouble, you can't be on the same device for the two things. You need one screen for this and one screen for the other.
right. Or you may be able to do on the app itself. So M word, she took the lead. Good job there. Answering fast, get you more points. So let's go to the next one. Okay, very good, guys. Good job there. So that's reactive attachment disorder. That is the right answer. So disinhibited social engagement disorder is something completely different. Uh, if you guys answered that correctly, good job. Next one. Man, so I think that one was set for 20 seconds again. So I apologize. I guess I didn't go through all the questions. So sorry about that. "60 seconds there for that one. You should know what PICO is by the letter, exactly what it means, because the test will try to confuse you. Each letter, they'll come up with something similar, okay? We have 18 answers, 20 seconds left. Okay, 10 seconds left. All right, so population intervention, comparison, and outcome, that's PICO, right? You should know what a PICO is. If you don't know by the letter what it means, you should write down right now. And you also should know what CAGE is. Someone please tell me what CAGE is. Go ahead, try it.
Alcohol screening tool.
Okay, but what it stands
Down.
for?
You need to cut down on your drinking.
And no, that is
Cut
every
down.
letter has something. Go ahead.
Annoy.
Cut
Guilt.
down.
Annoy.
Annoy.
So
Guilty. Eye opener.
okay,
I-
so that's your CAGE. Again, you need to know CAGE by the letter. Okay, just like PICO. All right, word is taking the lead again. It's on fire. Okay, this one's kind of harder, right? Cues in the theme of the question, and I think I answer rather fast, and I do apologize if that was the case. Anytime, I don't care what question it is, it says severe on the theme of the question, know that it's already abnormal. Anytime it asks the most likely diagnosis, it will not give you a full diagnosis. For example, what is a full diagnosis of major depressive disorder? You got to have it for 2 months. I mean, 2 weeks. You got to have those 5 symptoms. One has to be sad or anhedonia. It has to impact you on the social and social life and so forth, right? If the question says the patient has been depressed for some time, feeling sad, crying, and losing appetite with insomnia, and it's unable to say the reasons why, which of the following could most likely be adjustment disorder with anxiety and depression, major depressive disorder, blah blah blah. So it did not meet the criteria for major depressive disorder, but the cues and the symptoms and the how to answer those questions most likely. So don't get caught up like me. Oh, so strict. Oh, it doesn't meet the major depressive disorder, so it cannot be it. So what else could be, right? That's incorrect way. Don't be strict. Look and says most likely the diagnosis, most likely the treatment is asking for the best answer choice that would answer this question. Here, a disrupted mood dysregulation disorder. Here, with disrupted mood dysregulation disorder is a disorder that came because us provider were giving bipolar disorder like candy to patients younger than 18 years old. And they did the revise DSM-5 and said, well, let's call it this disrupted mood dysregulation disorder, because if you label someone with bipolar disorder, you can never unlabel them. Not the example here. If you said it that the patient is bipolar, and now it comes to you and you are going to diagnose the patient with major depressive disorder, that's wrong. The diagnosis doesn't change. It can be a bipolar disorder in remission. It can be a bipolar disorder with persistent mood, depressed mood. Why is it important? Well, simply is if you call a major depressive disorder and you move on and the patient comes to me and now I get the diagnosis of major depressive disorder and the patient looks like a major depressive disorder, but I didn't do my job well enough to look at the history, I may give the patient a SSRI. And next thing I know, the patient's out in a strip club, spending all their money, getting in trouble, right? Because I pushed the patient into a manic episode because I didn't do my job well of looking at the history. Same thing, PTSD, acute stress disorder. Do not, if the patient's been diagnosed PTSD, it can be a flare of the PTSD. It can be instigated due to a car accident or so forth, but the diagnosis is PTSD. Even if it's a new event, it's been diagnosed with PTSD, most likely the answer is PTSD. Don't fall for the 3 weeks after car accident, right? Because it's kind of like trying to get you to adjustment, acute stress disorder versus PTSD. Okay, hopefully that's clear. Understand that because that will be confused in the test. They will try to lead you to the incorrect answer by giving cues of the incorrect answer, but you know that once they have met a diagnosis, it's just like alcohol use disorder in remission. That diagnosis should be that in the medical records forever, just in remission, if that's the case. Okay. Okay, very good, guys. This question, no matter how many times I say it or how many times I show it on Facebook, always get people confused. You need to know exactly what falls under thought content and what falls under thought process. Thought content, simply term. What is the patient thinking of? Suicidality, hallucination, homicidality, committing crimes, whatever that might be, putting fire. How is the patient thinking? Disassociation, logic, word salad, and so forth. If you don't know these two, you will likely get the answer incorrect. Another question that falls in the same realm. Patient reported suicidality, blah, 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 with the planning intent. Where in your assessment would you document this? And then option A, we have patient history of present illness. That sounds good because I actually would do that as I am writing down the events of the last 6 months that brought. So the history of present assessment is nothing is, it can be answered by, in the last 6 months, what has changed? Why are you here now? Right? This is how I answer my history of present illness. I say to the patient, in the last year to now, or the last 6 months, what has changed? Okay, you had major depressive disorder before, you've been anxious, but why now? What changed? And how? What do you do to alleviate the symptoms? What do you do to, what makes it worse? What makes it better? That's my history. Now, I also do patient reported suicidality. However, the right place as your MSE. And your MSE contains the thought content and thought process. Okay. So in the thought content is what you're thinking of: suicidality, hallucination, homicidality, or what, putting fire in a building. What might be what you're thinking of, and how you're thinking is the thought process. Do not get those confused. Understand if the answer is MSE is probably correct, but if MSE is not there, then you look for thought process or thought content according to the theme of the question. All right, Becca is taking the lead again there. All right, so everyone got this correct. Let's move on to the next answer. Close my screen here. Okay. All right, Beck is still taking the lead there. All right, so the question asks which one could be contributing to her depression symptoms, right? What is St. George wort prescribed? Well, not prescribed, often used for
Depression.
depression. So it would not be contributing to, it could be contributing to a serotonin syndrome if this is what the question was asking, right? So for that reason, you eliminate that. What is anti-abuse known for as far as mania or depression?
Mania.
Mania, right? And also, what do we know about anti-abuse?
Liver toxicity.
And what's one very important education that you give to the patient?
Aversion. So you don't take any type of alcohol, or else you'll have you'll have a reaction.
It's a deterrent.
Okay, and the deterrent. Okay, so very good, right? Yes, aversion there, deterrent. We have to teach. Now, I want to clarify the time frame. If I have, how many hours do I have, if I have alcohol today and tomorrow I go to the doctor and has been 24 hours, it's okay to prescribe this medication, yes or no?
Yes.
Yes.
Okay,
Has
so
to be
I'm
12 hours.
okay, so I'm 12 hours. So now I'm taking the medication, has been 3 months, and I tell my doctor, I'm good. I don't need it anymore. I want to be out. How long how long after I can use something that alcohol related, not necessarily a drink? How
2
long do I
weeks.
have to wait? 2 weeks, right?
2
So
weeks.
12 hours before, 2 weeks after. Okay, very good. So questions here, this in general, every time you have a question and says the patient has been stable and is related to antipsychotics, it is related to antidepressant. If the question says the patient has been stable, you know that medication that has been prescribed is good. It's something else that was added. Then you're going to look at your list of medication that cause mania. Look at your list of medication that can cause depression. And if you see those, it can be in disguise. It can be prednisone. Well, you said here that mania is caused by uh, uh, can be caused by steroids, right? But it's in disguise. It's prednisone. It's a steroid. So, what is your next action, right? You could increase your medication is a possible answer, especially when it comes to antipsychotics, or most likely collaborate with the physician to know if that medication is still necessary. Repeat, when you have a question and it says the patient has been stable, and it says few weeks later the patient started a medication for whatever reason might be. For example, if it says that the patient is on lithium and they started a NSAIDs, what does the lithium do to the NSAIDs?
Lowers the renal clearance.
Okay, therefore cause liver toxicity, right? Or increase of the lithium level there, right? So it could cause toxic level. So you have to, not specifically for lithium, but for SSRIs or major depressive disorder, mania and mood and antipsychotics, collaborate with the physician to see if that medication can be discontinued or augment your medication by increasing the dose. More to that when it comes to question in relation when to increase the dose and so forth. Okay. Well done, guys. So it didn't say that the person goes around, around, and around, and eventually get to the answer. That is circumstantial thinking or circumstantiality. When the person doesn't answer the question, never gets to the point, that's tangential thinking. Clang association is like, I wouldn't say word salad, but it kind of rhymes. It creates new words in the conversation, right? It does sometimes make sense, and most of the time it doesn't, right? So that's a clang association, right? So good job there. All right. Kathleen is the lead there. All right, 24 seconds. Pick your answer. Okay, so lorazepam, we talked about this. We don't do diazepam for liver conditions. We kind of spoke about that. I would expect some people to get a composite or naltrexone because people always, a lot of people get this incorrect as knowing that a composite naltrexone And anti-abuse, they are medication for maintenance, meaning that the patient decided not to drink alcohol anymore, is not having withdrawals, and then we can initiate one of the three, especially a composite and naltrexone. Those two drugs, pay attention to this, you might see this on your test. Those two drugs have been shown by research to decrease the amount of alcohol that the patient's taking or help with completely no drinking. Okay. Now, even if they drink, let's say before they drank 10 beers, now they are drinking on the medication 3 instead of 10. That is a benefit as well. And not feeling as you know, the high of the alcohol. Okay. In summary, lorazepam loves liver, patient compromise, give the lorazepam. PRN only in the beginning. When they reach a higher level, will be PRN plus schedule. Patient doesn't have liver condition, diazepam. Why? Longer half-life. All right. Gabapentin, in practice, I use it. Oftentimes for the people that have anxiety and sleep problems, I could choose gabapentin. Is not FDA approved. Another point, every time, this is the test question, it could be, every time you prescribe a not FDA approved off-label medication, you have to document this is an off-label medication and the reasons why you are prescribing, okay, on your documentation, especially in real practice as well, because it could be that you being embroiled in a lawsuit later and this is not FDA approved medication. Make sure you say it's off label and the reasons why you are prescribing. Okay, very good, guys. So here, veracity, right? Understanding those ethical principles is super important. Okay, I do understand them. Put it into examples. Why? Because they can be confusing. I can see why this being fidelity, right? Oh, fidelity being faithful to the patient. You can make your mind can make up answers all day long, but knowing this is veracity, which is telling the truth, not the example. Very important. Not necessarily related to this, but the question came to mind. Patient has been taking medication X. FDA sent a warning for patients taking medication X. What is your next action? Call the patient and discontinue the medication since FDA has put out a warning for increasing suicidality. Option B, ask the patient how he's doing, if any notice side effect, and let the patient know about the warning. Right? Most people would be inclined to take the patient off the medication. The right answer would be conduct your own research, not your research, your literature search to find out more evidence about it. The wrong choices that the test may be leading you to is to take the patient off the medication because FDA has put out a warning about about whatever it is with the condition. The right answer is they're looking for that you are capable of looking at the research and making the right decision. So be on a watch out for a question like that. Okay. Does it make sense what I'm saying? Next question. Homicidal ideation. All right, everyone's kind of going fast here. I don't know why it stopped so soon. Maybe everyone answered the question, but homicidal ideation, antisocial personality disorder. In fact, 75% of those folks that have been incarcerated are likely to have antisocial personality disorder, right? According to some research. So now let me ask you a few questions related to homicide, no, suicidality and suicide attempt and ideations. Which ethnic group, other than whites, are most likely to have suicidal attempts?
Native American.
Why?
Uh,
Alcohol use.
alcohol, yeah,
Yes.
substance use.
Okay. Very good. I like the question. Which psychiatric condition is most likely to have suicidal attempts?
Borderline.
Borderline.
No.
Oh, schizophrenia.
Schizophrenia.
Oh,
Okay. Write that down, guys. That's two important questions that you may see on your test. Schizophrenia. A lot of people would say borderline. A lot of people would say major depressive disorder. A lot of people would say eating disorder. Okay. All
Repeat
these
it again,
answers are
please.
all those answers are correct, but schizophrenia has the highest number of, I don't know if it's suicide attempts or would I say, actually patients that passed away. Schizophrenia disorder would be your number one. Okay. Indian Americans, they would be most likely to commit suicide due to alcohol, larger amount of alcohol related um, cases. Now the question, Indian Americans, right? Patient comes to you and wants to refer, he wants to get care at a different center because he's going back to his community, right? So you transfer the care to a appropriate center that the patient agrees to go to, taking in consideration his cultural background, okay, if it's possible. Now the question, Indian American, if they want to have the tribe leader present, whatever that may be, or whoever the senior person may be, it's okay to be present, but they must sign the confidentiality agreement, that the patient is able to bring somebody else in and so forth. Okay, so you must sign all the paperwork. So can I just say, I want to have somebody here? They need to sign the paperwork in order to have them here. Now the question about Native Americans. Okay, remember when we talked about culture, right? Culture is important. Patient has a suicidal ideation with a plan and intent. Comes to you, reviews this to you. They agree for a inpatient unit. Patient says, okay, I'll go to the inpatient unit because I see that I need. However, I have this magic stick and have carried with me my entire life. In fact, everyone in my tribe carries one. And I say, okay, can you tell me a little bit more? And he says, it helps me protect me against evil or evil eye. Which of the following would be the most appropriate action for this person? Tell the patient that he cannot have this stick because it would potentially be a danger to other patients. Option B, tell the patient the patient will be admitted and he can have his magic stick. option C. It cannot be admitted. The patient cannot have the magic stick because it's against the hospital policy. Who thinks it's number A? Just say yes for me.
What was it A again?
A, admit the do not admit the patient with the healing stick because it can be dangerous to other patients.
No.
No.
Anybody thinks it's A?
You admit the patient with the stick.
All right. So anybody thinks the option C, you cannot admit the patient because it is against the hospital policy.
No.
No, right? So the confused answer is the one that you would answer because it's cultural related, right? Is admitting the patient with the healing stick, right? In real life, it may not make sense, but again, this is a test. It's everything is perfect, everything is controlled. So be on a watch out for that. Okay. Okay, well done, everyone. So lithium, what can lithium cause?
Epstein's anomaly.
Okay, perfect. So if you have a patient that comes to you with a heart condition and you assess the patient and you see a murmur on this patient, which of the following actions would you do? And the question says, ask the patient's mother if she was in lithium in the past, if she used the lithium. That would be your correct answer. So basically, it's doing a reverse of the knowledge that you know by acknowledging or asking the patient if his mother had taken lithium in the past. Okay. So it's kind of like the same knowledge, but used in a different context here. All right. Benzodiazepine, what does it cause?
Floppy baby.
Okay. What else? Lamotrigine. Well, no. Okay. Never mind. That's okay. All right. Next question here. Okay, guys, well done there. So first thing first, what is the condition? Neuroleptic malignant syndrome. The second question to answer, how do we treat NMS? We treat it with two medications, right? What are the two medications?
Dantrolene, Bronco.
Okay,
Mhm.
how do you answer a question if the two medication is in the question and the question is about NMS?
If they ask for dopamine agonists, we're going to answer bromocriptine. If they ask for a muscle relaxer, we're going to answer dantrolene.
Okay, very good. Please know this. This is very important. This question here always get people because they get confused. Cryptoheptidine. In which condition do we give cryptoheptidine?
Serotonin syndrome.
Okay, you need to know the difference, especially the difference between neuroleptic malignant syndrome and serotonin syndrome. Let's break this down. Serotonin syndrome, give me two specific things that I would find only on serotonin syndrome. Anybody?
Hyperreflexia.
And
Jitters.
close to jitters is a specific word that I'm looking for.
Irritability.
Restlessness and sweating.
We'll
My-
find out.
Myoclonic jerk.
Hyperclonic and
Okay.
hyperreflex.
All right.
Myonic,
Myoclonic jerk,
Yeah.
which is a type of seizure, right? So you can say seizure, you can say myoclonic jerk, and hyperflex. This is malignant syndrome. I mean, neuroleptic malignant syndrome found only in that case. Everything else can be found on neuroleptic malignant syndrome, right? So now let's talk about NMS. Give me 2 symptoms that you find only on NMS. What are they?
Rhabdomyolysis.
Okay, and
Myoglobin.
well, that's part of a rhabdomyolysis, right?
Yeah.
Mutism.
Mutism. Okay.
Yeah.
So you need to differentiate this between the two. You need to know the 2 medications for NMS and when to use it. You need to know the medication for serotonin syndrome, when to use it, and how to differentiate those 2 conditions. And that's about it. Okay. Obviously, you need to know your labs for NMS, right? And also know that NMS can be a delayed result of surgery. Like, let's say the patient went home, had the surgery in the knee, everything was fine, and 2 weeks later, this got those symptoms as well. Okay, it's both are life-threatening emergency. By 20 seconds, this question, you gotta be fast, guys. Pick an answer. Sorry. Sorry. All right. Very fast question, right? So you need to know the difference between tolerance, dependency, addiction, and substance use disorder. And these terms are interconnected in some ways, but they are different. Tolerance is when you're taking the medication. Let's say I take, I don't know, like some kind of opioid, 50 milligrams, and I've been taking for 1 year. And now I come to my doctor and say, look, it worked before, but it doesn't work now. So I develop a tolerance. Dependency is a bit different, right? It's like I've been taking this medication. If I stop taking it, I have a side effect. I have these withdrawals. Now, addiction is despite you have a negative consequences, despite of being fired, despite of a break in my marriage, losing my kids and losing everything, I still prefer the drug over anything else. Okay? So know the difference here is very important. All right, 20 seconds. Gotta be fast on this one, guys. Which neurotransmitter implicate in Tourette's? Fast. Fast. Come on. All right, well done, guys. So let's break this down real quick. Dopamine, which are the 3 conditions in which dopamine, norepinephrine, serotonin falls into? 3 conditions.
Tourette's. MDD.
And
ADHD.
okay, very good. So that's your 3 conditions that fall under DMS or DNS. So you should note that as we're going forward, we kind of pair things up and it'll be easier for you to associate them. Okay, good job there. I guess I didn't save my 1 minute questions again. Oh. Sorry, guys. I saved it, but since I started the
Humanistic.
yeah. So humanistic. If you hear Gestalt is a type of humanistic. Okay, we cover this kind of fast. Sorry. All right. So Gestalt is a type of humanistic. If you have your phone, your microphone, please unmute so that way we can discuss things here. So Gestalt is a type of humanistic therapy. All right. What do you know about interpersonal therapy? Who created that?
Kleiman and Weissman.
Okay, that's an acceptable answer, but it wasn't necessarily what I was looking for. But very good though. Didn't think anyone would actually go that deep. But yes, who else? All right. So which therapy was created by Carl Rogers?
I think interpersonal therapy.
Human.
It kind of falls in between, right? But Carl Rogers believed about self-actualization. Every time you hear self-actualization, that means that he believed that humans are meant to achieve success. And it was so cool to look at his therapy that he didn't even take notes. It was all about pay attention to patient and giving advice when asked, right? So if you hear Carl Roger, look at the self-actualization of the patient, their own beliefs and desires. Okay? My apologies, guys, on the second. I guess I saved it, but since I already had opened, I didn't really save it. So some will be 60 seconds, some will be 20 seconds. This question always get people confused. Very important to know. Okay, always get people confused. How? This is a pen. This is a cup. A glass. And this is a medication. All right. Can you tell me the three names of that I just showed you? Pen, glass, and medication. Right. If the patient are able to say within 1 minute, that's registration. Then I continue my interview and questions. 5 minutes later, I ask you, what are the three objects that I showed you? That is recall. So registration within 1 minute, recall after 5 minutes. Attention. Can you spell world backwards and series of 7? That's attention concentration. Okay? You need to know those three in detail to get the answer. You might have 2 questions on this little information that I just gave. Okay?
I have a way to remember that. I have a way to remember that.
Please go ahead, share with us.
So always remember, when you go to a class, first thing you have to do is register, right? You have to sign in, register. That's the first thing you have to do. So anytime somebody asks you to remember something, the first thing you have to do is register, and then you can recall.
Beautiful. That's it. That's a good way to remember. Registration is first, recall is last, later. Okay? Thank you for sharing that. Next question. All right. Suli is still on the lead there. Thirty seconds left. All right, pick your answer, guys. Come on. All right, so that's the best answer. Can you do clonidine? Yes, in practice, but for the test will be minipress or prazosin, right? Now, for treatment option for PTSD, pharmacology, SSRIs, especially Zoloft, can be given. The main treatment overall, EMDR or cognitive behavior therapy. Who created cognitive behavior therapy?
Marshall
Aaron Beck,
Lanahan.
Okay, so Marshall Lamiham. So who created
That's DBT.
DBT? So who created DBT?
Aaron Beck is CBT.
Yes, correct. So don't get those two confused. And these two are two important names that you need to know. Who created CBT and who created DBT? Do not get those confused. Okay? All right. Use process of elimination. Okay, guys, use process of elimination. How can you answer this question without knowing the answer? It
So
said
almost
which
Lamictal is not an antipsychotic, nor
it-
is well, Vraylar is, but yeah, Lamictal is not an antipsychotic.
right. So you take it away lamictal right away, right? So you have um two, two mood stabilization their medication. Why would you prescribe them together? I teach you on my psychopharmacology course that I always do a mood stabilizer and a antipsychotic because the mood stabilizers are very good for the mania, but not so good for the depressive symptoms. So usually I like Lamictal and a antipsychotic, right? Or Depakote and a antipsychotic together. Now here, process of elimination. Then you have Haldol. That's second generation. I mean, first generation. Most likely, I wouldn't use. Then you have caprimazine. So I wouldn't use that. That's like a newer medication as well. Then what's left, right? Alazapine. We use alazapine a lot in the inpatient. Why? Because we want to stabilize the patient and get them out. But we do not use them as much on the outpatient because of the metabolic syndrome. Okay. All right. Question is not usually ordered in a patient without other comorbidities. Which one you would not do? 20 seconds. right, 5 seconds. Got to pick an answer, guys. Keep moving. Well done. So if I'm concerned of a metabolic syndrome, I will order the lipid panel. I will check weight, BMI, and circumference ratio. I will order HbA1c because I wanted the levels to be less than 6 normal, because it doesn't matter if the patient just kind of tried to cheat today and didn't get sugar. I will know at the average in the past few months, and I want it to be less than 6 preferable, right? When or for what condition do I order a ESR in general? What am I looking for if I'm ordering an ESR?
Kidney issue.
Inflammation.
Inflammation, right?
Yeah.
So that
Inflammation.
yeah. So if I'm
Maybe
concerned,
Rheumatoid or
yes,
osteoarthritis.
RA, osteoporosis. If I'm concerned about those disorder, it tells me that there is an inflammation. It doesn't tell me it is where the inflammation is or it's specific, or it's non-specific. It just gives you a cue. There is something else going on, right? So, and that's not the case for metabolic syndrome. Oh, that was fast. All right, 60 seconds for this one. This one will get a lot of people confused too. Okay, so this question always gets people. Let's break this down. You have a patient that is a harm to himself or others. Okay, it's not incorrect to admit the patient because it's a harm to himself or others. That could be okay, but the best answer would be to call the police. Why? Because you have the duty to warn, but you don't know if that applies to your state. Calling the police, it's always the right answer. Calling the nursing board almost every time is the right answer, because you seek information about what you should do. In practice, are you really going to call the nursing board? Or do they ever even answer the phone? No, they don't, right? So, but this is a test. Now, let's flip the situation, same scenario, same everything. Same everything, but it's cue you in you looking online to see the regulation of your state and decided to call and decided to alert as a courtesy to what should you do next. You look at the regulation of your state. It didn't say necessarily, to find out what is allowed and not allowed. And the answer choice here is to tell the father. That would be correct, right? But it wouldn't be also in the same answer choice as in having the nursing board or calling the police. It couldn't have all the answers in one question, because all of them could be correct. Okay, but if the stem of the question alludes to, you look at the regulation and found what is appropriate and not, or something along those lines, kind of cue you in that you looked at the regulation and you understand what it is, and one of the answer choices now to tell The father, because he's in danger due to the Tarsoff principle, duty to warn, it's going to give you cues that the patient looked, that you, the provider, looked at the regulations and you understand and applies to you. Now you can alert the patient or the person that may be in trouble. If it does not give you the sense that they're looking for the Tarov principle, that it doesn't, it's broad, you do not pick that because the Tarosov principle does not apply to every state. Broad answer, call the police. Broad answer, calling the nursing board to find out more about it. Okay. Can be very confusing, just like this one was. Right answer, call the police and report the intent to harm. You can never be wrong with that. Right? Even if you are wrong, no one would fault you for calling the police and seeking the right treatment.
So
I'll answer right off this question because I can stop, okay? I'll answer right off this one. Okay, we'll go back to this question, but let's review the previous question there. I do not see your name. Could you please come online and let me know what was your question?
Yeah, with regards to the last question about the Tarasov. So if the question mentioned Tarasov, then you notify the individual. But if it didn't mention Tarasov, you report it to the police, right? Because the question has both options: report to the father, or let the father know about the intent to harm, and the other option talks about reporting it to the police.
Okay, so if the question kind of implies that you're looking for the Tarasov principle,
Right, the law.
right?
That's the
Looking
law.
at the law, looking at
Then
the
you can-
state, the
Yeah.
state, what you're allowed to do. It's kind of implying that you look, and the answer is to tell the victim, a possible victim, of intent to harm. That is Tarasov. But the question would never come in a way that it says that and probably call the police at the same time because both are correct, right? So it could be argumentative. So questions, before they become valid, they come into the pre-test, the 25 question that you get. I got someone highly upset last time because she was like, I did not pay for the 25 questions that are the pre-test. They shouldn't be doing this to me. I said, okay, but you are also benefiting from the people before you that took the pre-test, right? Because if the question is bad, we make wrong questions all the time as providers. We think one way, but it doesn't clearly specify for everyone what the question intent is. So they have to discern between a bad question. What is a bad question? It's one that only 40% of the people get it right. That's a bad question. You cannot assume that all prepared graduate students are getting a question at 40% correct. You for a question to be valid, it has to match a percentage of people taking that question and getting more than 60%, right? Because if everyone's getting 30%, you better look at that question. There's something not right? So they have to discern. If the question comes with calling the board, calling the police, and also it is a question about alerting the possible victim, it should not be in the same question. It'll be other answers. But the key here is that you look at the regulation, you look at the law, and you understand the law of your state, and you provide an answer according to the question, to the stem of the question. Okay. Another super confusing point. Does that make sense? I'm sorry.
Yes.
Okay. Another super confusing point that will get people in trouble. Triangles, triangulation. Usually it's a bad thing, right? Let's say I have a fight with my wife and I'm using my 8-year-old daughter to deliver my message. So I am avoiding a resolution and I use the child in between. Oh, I don't want to talk to you about, I don't want to talk with your mother today. Go tell her to do X, Y, and Z. She goes there and she says, well, I don't want to talk to your father today. Tell him to go take out the trash. Whatever might be the situation, right? So it's not good. Now, husband and wife comes in and use the therapist as a mode to accomplish a task or talk about the problem where the therapist is the triangle that kind of fits the communication, then it is a good thing. Okay? It is a good thing. So it can be bad, it can also be good, but it can also serve to decrease anxiety and also serve to increase anxiety depending how it's used. Okay. Solution focus approach. Family therapy, you need to know each one of those. Let's break this down. Structured therapy. Tell me 3 things that falls under structure family therapy.
Hierarchy.
Hierarchies, yes.
Yeah. Mapping.
Yes. You're good. You're doing good.
Is it a genogram as well?
Sure. Mapping, geogram, yes. And boundaries, right?
Boundary, yes.
Boundaries.
Yeah.
Okay, so write it down. Structure is like the military. We have hierarchies, which is the rank. We have the mapping, which is the genogram, and we have boundaries. So structure therapy is like the military. Think of the military as rank, maps. We need map, we need structure, and we need boundaries, right? I can, as an officer, I cannot let someone else just come to me and talk however they want. We have boundaries, firm boundaries. Firm boundaries in therapy is not necessarily good, but you need, what's good is clear boundaries, right? You don't want enmeshed boundaries that, is this right or wrong? I don't know. I'm confused, right? So that's not good, but you want to clear boundaries. So solution focused therapy. Solution focused therapy means that they have used something that worked in the past. What are the 3 things that I find under solution focused therapy?
Miracle questions,
Miracle question. What else?
scaling,
Scaling.
exception.
Okay. So tell me, what do you find under what is the other one? Solution. Jesus.
Family systems.
Okay. No, well, we'll go back to family system, but there is another one.
Strategic.
Strategic. Thank you. So what do you find under strategic?
You find the
Directives.
Directive. Strategic equals
paradoxical.
directives. So what directives goes into strategic?
Straightforward, paradoxical.
Paradoxal, and metaphoric, right? So these are the things that you need to know. So the solution, you have miracle question, scaling question, and exception question. Strategic, directives. What kind of directives? Straightforward, paradoxal, probably the 2 that you need to know. And metaphorical directions is also one.
So
Now,
okay.
go ahead. Go ahead.
I was going to ask you, what does if we don't need to know it, you don't need to answer.
Well, metaphorical is like, before you turn into a butterfly, what were you worse? Trying to, it's a metaphorical for, trying to fit in the experience that the patient is living. Perhaps, what you're going through now, it doesn't really dictate who you are. It's just a rock on the road, and where you will be, it's what's coming next. So a lot
like
of,
metaphor.
yeah, metaphor. So a lot of people get stressed because they didn't pass the test before, right? And this stress is due to their past experience. So we have to break the circle through therapy that, hey, this happened, I acknowledge, but it does not dictate what will happen next. So let's work together to remind yourself that you have been successful. You are a successful person. You graduated from your BSN. You graduated from your master's degree. You graduated from your doctor's degree. You are a successful mother. People love you and care for you, and you are the backbone of your house. There are so many good things that we can talk about you, right? And we start picking what are the good things and reminded the person how valuable she or he is, and that just because you failed the test is not necessarily, it was an event. It doesn't determine who you are. So using previous knowledge to decrease the anxiety in a way, right? So that will be sort of actually that will be more like a solution focus, but can also be strategic. So if I say this is strategic, I would say I want you to go home and memorize PDF number 1. Now, once you memorize PDF number 1, I want you to go through the 23 topics that we have there. Look yourself in the mirror and talk about each one of those topics. Got it? Got it. Now, I want you to go to the Brainscape app and make your own cards and memorize it. So that's a straight directive. Paradoxal is, I want you to go home and fight with your wife. Very dangerous, because I'm assuming that the patient will not do what I asked the patient to do, right? So I don't want to go on because it can be a whole class on this. But another thing that I want you to highlight is the family system therapy. Here we have mapping, not so much high yield, but triangulation. And the number one thing you need to know for systemic family therapy is what? Self differentiation. Write it down. Systemic family therapy. Self. Why? Because you are a individual important component of the family. But you are not the same as the family. You are an important person that will develop your own skills and ability within the family and make this a family, right? But you are your own individual. Like my daughter says, Daddy, be your own. Stop copying mommy, right? That's family therapy right there. So be your own. You still bring your own loads of things to help out, contributions to the family. But you are an individual point in this system. Very important. Oftentimes comes back as what is the main point or the main argument for this type of therapy? Self individualization, but it's still part of the family. Self differentiation is the word that comes out. Self differentiation. Write that down. All right. Sully still taking the lead there. All right, I better get this right. All right, we got 30 seconds. Get this one right, guys. Come on. Anytime you hear replace a negative thought, distorted thought with positive symptoms, only one therapy really should come to mind. The rest is just fluff. Oh, not quite. Well done, everyone. So cognitive behavior therapy, it's all about replacing the distorted negative thoughts with positive thoughts, right? You need to know who created Aaron Beckham, right? And you need to know the last part of the question there. Journaling, diary is important. Now, what other condition do I need? It would be important for this test for me to know about journaling. What other condition comes to mind? Go.
Borderline personality.
So borderline personality disorder, you need to write it down. Equal journaling, diary, right? When it comes to an assessment, the therapist may use the journal diary as a form to come up with a diagnostic. Borderline personality disorder is the one that, please don't leave me. Therapist go home on a vacation, patient goes super upset. Please don't leave me. It's like I cannot live without that person, that interaction, that especially intimacy, right? If you leave me, I'll kill myself, or self harm, um, self harm intent. Let's talk about DBT real quick. What is the number one function of DBT?
Emotional regulation.
Close.
Restructure.
Yeah,
Reduce
all that is correct. But the
suicidal-
number one is decrease suicidal behavior, decrease crisis, intervention, or being able to self-regulate. That all falls in decreased suicidal behavior. DBT, Marshall, Lineham. These probably three questions that you may or may not be on your test. You should know. All right, we're almost there, guys. I know I'm kind of giving you extra along the way. Hopefully, it's not too much for you, but all right, answer fast. We got 50 seconds. All right, we got 20 seconds. We got to answer more. Okay, very good. So pruning, actually there is two possible questions here within this question. So pruning is the connection that don't serve any purpose. They are kind of cut off, right? So it's a cleaning up. Think about the bush. You're pruning the bush, right? To make it that perfect bush or fence, whatever you want to call. Apoptosis means cell death, right? You need to know the definition of apoptosis, okay? And refinement is something that I made up. I don't even know. And the regression. What is regression? All right. Regression.
Regression
So
is unconscious, suppression is conscious.
okay, so yes, so it's regressing to is part of a self defense mechanism by Theodore. It's regressing to our earlier time. For example, if my wife says she's gonna leave me, I'll cry on the floor like a baby, putting my knees to my chest, curling up. There will be a regression. Okay, as well. So, suppression would be the suppressing the feelings of the past. Feeling depressed and anxious, crying, lack of appetite, difficult concentrated. What does it look like to you? 3 weeks. All right, we got 25 seconds. Let's go. Okay, 5 seconds. Come on, guys. Okay, great. So if you didn't pick adjustment disorder, I want to like know why. Tell me why. If you pick something else, tell me please why. Give me a rationale.
No, I rushed. Or no.
Mhm. It got to be a reason why. So please, somebody. All right, this the question will be on your test in one way or the other. Okay, how do you differentiate between? Actually, maybe 2 or 3 questions I'm looking at here. So, questions about major depressive disorder usually cannot say why. Usually may not give you the whole symptoms. They will say, I don't know. I don't want to try. I don't care. Right? So this can be like major depressive disorder, delirium, and anxiety. That kind of falls into that. Adjustment disorder. Adjustment disorder. Adjustment disorder. It has a cause. What is the cause here? The virus. A treatment, right? It had a diagnosis. What is the cause? My mother had a car accident and she's in bad shape. Now I've been crying, depressed, want to quit my job, stop my relationship. What is the cause? I was diagnosed with cancer. What is the cause? I lost my house on a fire and I feel X, Y, and Z. Right? And then you can fall into many type of adjustment disorder with depressed mood, with anxiety, with disturbance of a conduct, adjustment disorder with emotional disconnection, and so forth. Doesn't matter. Then you match the symptoms to that occurring adjustment disorder. I say that all the questions on a test is the most likely disorder. There is one exception. One exception. Generalized anxiety disorder. Write it down, guys. Got it? Write it down. It has to tell you 6 months. Right? Everything else is pretty much an open shot. But generalized anxiety disorder is like this. I'm sleeping. 2 in the morning, I wake up. Where's my birth certificate? Oh my God. Do I have my passport with me? Like, comes out of nowhere. Is always worry, excessive worry compared to the situation. And it's about everything, right? It's about, have you been a worried child? I always ask this. Have you been a worried child as you growing up? Tell me how was it? Yeah. Yeah, man. I actually have I always been worried. I will wake up and, go to sleep and my mind is racing, thinking about odd things. Yeah. I think you have generalized anxiety disorder. It has to give you a 6 months period because of it's sad that
My lecture. I like to read, I like to study.
sorry guys.
No, I was done for the evening. I was actually YouTubing some songs.
If you have a hot mic there, you have to kind of close. So with adjustment disorder, that's the only one that has to tell you 6 months or more. Okay, adjustment disorder, it has to tell you a cause. If it doesn't have a cause, then look the symptoms. Major depressive disorder. If the symptoms are fast, 2 weeks, 3 months, 4 months, 5 months, then it could be major depressive disorder. If they are longer, unable to say when the patient is trying to answer a question, this is dementia-like disorder. And then you have to break it down which type of dementia. We'll go through this in our course. Hopefully, you're getting the cues how to differentiate. Now, here, there was a tactic that I told you earlier today. I put a timing. And how come it's not acute stress disorder? To be acute has to be traumatic, has to be a sexual assault, beating up, being shot, someone being exploded by a bomb. right? And that's the reason why it's not acute stress disorder. Am I clear here? Because from this question alone, from the understanding, you'll be able to get a 5, 6 different questions. So it's very important that you understand this. Who does not understand and who needs a further explanation? Now is the time. Please go. Okay, next week I'll put in the same question and hopefully everyone gets this right. All right. So if you do have a question, I'll be here after this and we can talk one-on-one and help you out understand. Okay. But I prefer that you do it now, not on the test day. Okay, beautiful. Well done, guys. Most of you guys, you got, I don't know. The question said, I don't know. I don't care. I'm not trying. The question said for the past few weeks and had symptoms of dementia like for the elderly, which is called pseudo dementia. So we kind of just killed in. This is a pseudo dementia. Okay. Lewy body dementia. Tell me the number one characteristic of Lewy body dementia. Anybody, please go.
Visual hallucinations.
Okay, so the patients having visual hallucination. Oh my God, I am seeing my mother on a wall. Are you going, which antipsychotic are you going to prescribe?
Aldo. Or clonazepam.
Anybody else? None. It's part of the condition, right? Sorry, I had to mislead you. Okay. So you do not prescribe antipsychotics for hallucination in Lewy body because it's expected. It will make it worse. Write it down. No antipsychotic. Okay. Now, dementia patients that have hallucinations, and then you can prescribe antipsychotic because it's the only way that you will stop having hallucination, not for Lewy body. Got it? All right. So that Alzheimer's, number one type of dementia, right? Is this cortical or subcortical?
Cortical.
Cortical, right? So cortical above the cortical there. So when you say cortical, what is the two things you need to know about cortical?
It's personality changes.
They have amnesia and aphasia.
Amnesia and aphasia. Amnesia and aphasia. Amnesia and aphasia. What are the two words that can be fall under amnesia and aphasia? Right. So that's complex, but like if you give me characteristics of the two things.
Language and memory.
Okay, so perfect. Say it again. You said memory and
Language.
Language, right? So next to cortical, we put it amnesia and aphasia, and we put it language and memory. Subcortical is under the cortical. What are the two things that fall under subcortical?
Movements.
And personality change. So okay.
Psychosis.
So we
personality,
personality changes, yes.
Yeah.
So then we kind of can break this down into the symptoms that falls under that. Then you look at the question, you ask yourself, is this cortical, subcortical? I divided for you in the program. All you got to do is match it. It's simple. I know it can be complicated because there's lots of them, right? but we can simplify this process for you. Okay, I'm not gonna go over here, otherwise I'll take another 10 minutes. I don't
Wait,
want this to be.
Can I ask
Sure, go
Dr.
ahead.
Lopez? But in Pick's disease has personality changes,
Right.
and Pick's disease is cortical.
Correct. So Pick's disease is one of the exceptions. Pick's disease is one of the very highly, it's kind of fast, really fast, right? So how is Pick's disease? What's Pick's disease also known as?
Frontal dementia.
Frontal lobe.
Okay. So that is kind of part of your personality.
Yes, definitely.
Part of your personality. So that one is a bit odd, but yes. That one is a bit odd, but in general, right? Because everything is kind of like we're going broad here. Is a front temporal dementia is a neurodegenerative disorder. That means that affects the neurons, gradually stop working. The brain cells is affected areas and they kind of fail. They can have atrophy and so forth, right? So that one is kind of oddball, but that's a cortical one as well, right? So, any other questions? Okay, we're moving on to the next question then. We'll go quick, fast because we still got 20 more. Okay. Talked about this earlier. Everyone, please get this right. No pressure. All right, we got 10 seconds left. Pick an answer, guys. Under 1 minute. Beautiful, beautiful, beautiful. Now, can someone tell me why you picked Depakote? Anybody, please? Right. So I said it earlier, right? The symptoms of lithium was heart related, right? I give you a murmur and I ask if the patient comes in, ask his mother or her mother if she was taking lithium, right? So everything that's being said in these live events, you should be writing down, okay? Because a question will most likely come up on it. Some way, somehow, different wordings, but the principle is the same, right? So you could say that lithium cause heart problems. Now you have to apply how does it apply in clinical practice. Okay. Labile is the key answer here, right? What does it mean? If you call someone in assessment labile or pressure in speech, you are given impression of a condition.
Mhm.
So be careful when you say the patient has pressure in speech because you really like pushing towards something.
Bipolar.
Yep. So we got the 17 answers, 17 seconds left. All right, it's 5 seconds. Perfect, right? Guys, do not give them a PHQ-9 because a PHQ-9 is for major depressive disorder. Labile, if you hear labile, you know, it's always a mood disorder questionnaire, MDQ.
Except in a child who is less than 18.
Right. However, you still could give them a mood questionnaire to address a bipolar-like condition.
No.
right? So yeah, you still give it, but it wouldn't be called for bipolar, right?
Thank you.
Absolutely, yes. Because actually, a very important question that might be on your test as well. If it's under 18, you still give them a mood questionnaire, but you're not going to give them a bipolar uh, disorder diagnosis, but you will give according to the patient's age and what's going on there.
Okay.
Mood dysregulation. All right, process of elimination, pretty easy, right? Remember, in our strategy class, I said that when the three things fall within one category and the other one doesn't, pick the answer, even if you don't know. If you don't know, obviously use the strategy. Here, you could have used the strategy to get to the right answer, even if you didn't know. We have three medications that falls under SSRI and one that doesn't have serotonin. What other medications can you give to decrease sexual dysfunction for those patients that have been taking SSRIs, other than Wellbutrin? Wellbutrin is number one.
Another class.
Another class. Give me another class. What is it? Partial agonist.
Mhm.
Which medication is a partial agonist? It Buspar. Buspar is also, you can do that, right? You can do Buspar. I do Buspar
Mhm.
for anxiety. I do Wellbutrin for depression. Usually that's how I divide and conquer. And the patients, the best combination is an SSRI and Wellbutrin. Usually I get 100% patient recovery when I'm treating them. Give them enough time, enough dose, don't change the dose, follow up. Within 4 months, they're almost 100% not cured, but have 90% of the symptoms uh, disappear. It's like a new patient that I'm seeing in front of me every single time, all day long. Understanding your psychopharmacology, it is your bread and butter. Passing the exam is important, but that's not the end. Understand how the medication works in depth. You are meant to be the cream of the crop.
Does the pharmacology course covers that? The one that you were working?
Oh, it does in super detail, like you have never seen before.
Okay, great.
But I don't say it. I don't want you to take this class before the test.
I
Because,
know.
yeah, too in depth. It's too much information. We don't need that. Right now, we worry about the test. But once you pass, you want to be the best prescriber out there.
Right.
You
Exactly.
want to be able to go to your boss and says, "Hey, I don't work for less than 200,000." Why? Well, because all my patient wants me back because I make things happen, and you are that confident prescriber to do so, right?
Great.
And that's what you want to be, And you are able to discuss your condition with a psychiatrist. They come to you for information because you know your stuff.
Thank you.
It's an important question that you, okay? All right, very important there. That is the definition for Capgras syndrome. You should know what it is. Prigoli, it's kind of similar, but it's like I see 10 people and they all are one person, right? So it's kind of like identical, but it's one. while capgras is a bit different. You should know the definition of these two. Okay. All right, let's move on to the next question. So we covered this under our our strategy course today, right? So what is the problem here? What kind of dilemma?
Ethical dilemma.
Yes, but perfect. Well done, guys. I love to see you succeed. The dilemma here is the privacy of the patient and keeping the report, keeping the patient coming. First, the parents need to know, right? So you're in a pickle here in between and trying to kind of like, it's like an octopus, try to kind of like manage it all over the place. That's what you are in the pickle here, right? So you want to keep the privacy, but you also want to keep the parents happy, but not at the expense of the patient. If he is to release important information, you should not do it, right? Unless if it is a safety concern. Okay. Q, you have a patient that gives you where the patient's from, right? So you give it a culturally appropriate response.
Mm.
All right, we got 30 seconds left. Beautiful. Okay. Very good, guys. I'm proud of you. Can you tell me more about your health practice? Right? Pretty broad, not very aggressive, not very scientific, but I am answering in a way that's safe to say that, hey, I am listening to you and I'm not necessarily totally ignoring the symptoms, right? Can you tell me about your health practice? That shows culturally competent care. Usually will be a broad question. Answer. All right, 35 seconds. What would you do? Come on, we got 10 seconds left. Pick an answer. All right. Let's see. Let's see. Well done, guys. You guys are getting this. You are crushing it. Remember, today we covered patient first, patient safety, even above the law and the other interests. Right now, what can I do for the patient? You are in a safety place, right? Later, I would do the police, I would do the, not showering, all that's important. Right now, is a patient-oriented answer. Okay? Again, this is a task. Everything is perfect. Ensuring the patient's safety is the answer. Does it make sense? You have to really understand, put yourself into the test makers. What do they want? This is not real world. This is not in my office where time is limited, money is a problem, resources not available. This is the perfect environment. You are safe. It's like you can stay here forever, right? In a sense, not really, but that's what they want. Look for patient-centered, safety first answer. Even though calling the police sounds really good, right? But we'll do nothing if the patient is crumbling on the ground, feeling unsafe, right? So the question asks about priority. When you get a question about priorities, you do three things. Go through the list. All right, we got 15 seconds. Pick your answer. All right, you got this. Come on. All right, beautiful. You guys are crushing. You have a priority question. Let's break this down to a understandable level. You have a priority question. What are the three things that you do in the priority question? You do airway, breathing, circulation. Is that a airway, breathing, circulation? Yeah, the vital signs are airway, breathing, circulation. But if it wasn't one, then you move on to Maslow hierarchy of needs. If there is no Maslow hierarchy of needs, you move on to nursing process. In the nurse process, labs, vitals is also part of the nursing process. Assessment, anything that's giving you data to come up with a diagnosis and treatment is an assessment, right? So here happens that vitals fulfill the criteria number one, which is airway, breathing, circulation. Okay, so order lithium level, it could be okay, but it's not going to give me the most bang for my buck here. The patient could be hyponatremia. The patient could be hypoglycemia. I'm sorry, right? Some of those symptoms are like that. So important here is to get an EKG immediately and get the vitals, right? That can be life sustaining. We cannot delay that and wait for the labs. Hopefully you understand that. All right, 40 seconds. All right, we only have 13 answers. Okay, so we are in a counter transfer working phase, right? So counter transfer termination phase is when you kind of ending the process. Transfer is the patient towards the practitioner, and the transfer working patient is when the patient is transferring the symptoms or feelings towards the practitioner, yet working on it. Okay. Hopefully that's clear. Always understand the counter transfer and transfer, what it means, and PAPLAO, termination, working phase, and so forth. All right. Suli took the lead again. So you know this is something in the prefrontal cortex. Would you say prefrontal cortex parietal? Would you say prefrontal cortex ventral? Would you say prefrontal cortex anterior or dorsolateral? It's another technique that you can answer this question, right? So it's a dorsolateral, right? Here. So you have the dorsolateral part of the prefrontal cortex. So you could potentially answering this question, at least eliminating two answers by applying the wording of the questions and kind of fitting in the answer choices and see if it kind of, have you heard of that? Prefrontal cortex parietal? No, never heard of that. So it could eliminate that just by that. How about ventral? No, right? All right, we got 11 questions. Delayed and empty gastric. So you're looking for medication that will help you manage the symptoms associated with delayed empty gastric. What is it? All right. So let's say you do not know this answer. How could you respond to this? All right. So you look at the red there, you have a ondansetron and promethazine. And then here on the green, you have also ondansetron. And then on the blue, we have promethazine. You also have the promethazine in the red, kind of just switching few medication. But what do you have that's totally different? Metropyramidate and norepinephrine. So if you apply the test taking strategy to the questions that you do not know the answer, you could easily get the question right. Right? So here's a prime example. When you have three questions, three answers going one way, and you have one totally oddball, you don't know the answer, pick the oddball. Right? Metropyramidate, it's the answer that you should be aware of for delayed gastric emptying.
Yeah.
All right. So you have the medication and it works by reducing the urine production by the kidneys. Okay. So kind of looking for a test taking strategy here. I think it would be just knowledge. But yes, need to know that. It says, in addition to exploring possible psychological factors affecting the child well-being. So we took that into account. What else is left? Okay, so we know that nightmares are familial history of that kind of pass it on, right? So that would be the appropriate question. Another cue here is that, hey, I already took in consideration the physiological factors. Now, the physiological factors here are the dopamine, I'm sorry, the serotonin. And a lot of people would pick norepinephrine. The answer is serotonin related to nightmares. Okay, so all the other answers are possible, but the best answer choice is familial, kind of knowing that passed from family generations. And that might be normal for that person. Oh, just answer the question. All right, very good there. Any type of here insomnia associate with serotonin, okay? Insomnia, put an equal serotonin. Also could be GABA, right? Because GABA, you relax. GABA is the most abundant neurotransmitter for relaxation, right? Most abundant activating neurotransmitter is what? Anyone? Abundant neurotransmitter for
Acetylcholine.
Glutamate.
glutamate. For exciting.
That's right.
Exciting is glutamate. Calming down with GABA. If you hear
Well, that was his
serotonin,
question. Why isn't it norepinephrine? Because that's fight or flight. He's afraid. 'Cause he's
right?
ready
But correct. But it has to do with the insomnia, and the insomnia has to do a lot with serotonin. It is a hard question, and it kind of prompts you to norepinephrine because it's flight or fight. But he is more because of insomnia. He can't sleep, and has to do with the reading, storing books, and being afraid as well. Okay? It's a bit of a difficult question there, for sure. But what is the best or most effective way to engage and make a positive impact? Mental health policy. What do you do? "18 seconds." All right. So if you want to make a difference, right? You join a organization that's going to support your cause. Take, for example, now Florida, the FMPs, they are able to prescribe the loan, yet PMHNPs are not. So the FMPs, they did a wonderful job by collaborating together, put some money together, putting some minds together to achieve their objectives. You can write as many blogs as you want. You can work on your workplace, but you are very limited of what you can do. But if the 50 of us 200 of us ask our congressman the same law and say, hey, if you don't pass this, I think you will not have a successful you'll be a successful candidate. They will pass. Of course, they'll need more than 200, but when we love together, and one way to do that is by joining a state nursing practice or association, ANA, and so forth. Okay, because the money is well worth it for your association. You'll get more if you join in than you would without joining. My opinion. Try process of elimination as well. All right. It is a complicated question, okay? It may be even a poorly written question. But here the cue is that the patient first or the mother decline medication. So she is scared of medication. Now she comes back and say, hey, I would like more medication, right? It didn't give you a cue to say, I don't want a stimulant, right? But the cue here is work. Um, it will go away fast, right? So by saying it doesn't last all day, you can take the Wellbutrin out. This is 24 hours, right? The Excel formulary. You can take the Cetrata out, and then you left with the phentermine salts guanfacine option. So kind of in reality, all the two answers could fit the bill here. So the question should have been like more descriptive of a non-stimulant. But I was trying to convey that message without saying it. Okay. But good job if you answer amphetamine is probably correct as well. A test question would not be this unclear. All right. But guanfacine, you need to know that is an alternative. You can prescribe for ADHD. However, is short-lived medication that works, but not as well as a stimulant, and will go away out the body faster than a stimulant would. Okay.
And I have an extended release, right, of the guanfacine?
It does as well have an extended release. Also used for those with Tourette's. Can be used for Tourette's. The question here is most affected. All of them are affected by it. Most. Patient education, every time you have omeprazole, you should tell the patient to take 2 hours away from all other medications. That's important. You should know this detail. Now, most affected is TCAs, okay? Hard questions. If you didn't know the fact, I don't think you could have answered. TCA is the most affected out of omeprazole. But the question that often comes up is what you need to tell the patient. If the patient is taking omeprazole, which of the following patient education points you need to emphasize is to take any other medications after 2 hours, okay, of taking omeprazole. All right. So for some reason, I always get people confused on this question. You need to know factition disorder. You need to know factition disorder imposed on another, mother imposing on the child, wife imposing on the husband, husband imposing on the wife. You need to know the difference between conversion disorder, factitious disorder, malingering disorder, and somatic symptom disorders. If you don't know those in details, it's unlikely that you get this question correct coming up in a test, right? So if you are part of my course, really, really, really you need to know this, okay? So in fact, everything that's in the course is you absolutely need to know. So hopefully, if you don't, I'm going to stay behind here after this class is over, and we'll go over this content with you. So it is not an exception of release, right? Keywords is not. Okay, so our hard question, right? Do you need a consent when it's a mandatory county health reporting condition? No, right? I can't think of one that's mental health, but there are some medical conditions you don't need consent, you have to report. Do you need consent for the insurance for the that's paying for the case? No. They need to know what it is, so otherwise we won't get paid. If applies to the Tarasov principle, you don't necessarily need the consent either, right? Now, if the patient primary care provider is already giving a verbal consent and now before, right, to treat whatever, now is treating a psychiatric condition, they kind of need a consent in order for you to release the records for related to the case that's psychiatric. Hopefully that's a little bit more clear, but you need to know the case in which you do not need the consent. Okay? Very in detail. Right. So if you have any heart nurses, critical care nurses, you would get this right. Okay, guys. So very good there. Adenosine, right? We in critical care we use adenosine all the time for heart conditions. Definitely puts the patient to sleep there. Norepinephrine, we want kind of stays put people to stay awake, right? Glutamine would place people to also stay awake, right? Then you have left adenosine, acetylcholine as a possible answer choice. So this is an administrative action, right? And you want to predict financial visibility of the business. What do you need for that? So the key here, answering predictable finance. That's it. What do you need for that? Who do you ask for? You want to open your own, not buying. Okay, so financial disclosure would have been correct if you were buying. It says you want to open your own, right? You don't need approval of the business from the city to assess financial validity of the business. And you might want to get a small loan application, but that doesn't determine if your business will be successful. However, a proposal expense and revenue report would answer the question. Remember, here we have 4 possible answers, but only one answer is answering the question. Not that the others are wrong, but it falls back into, is the answer choice answering the question? Strategy. Last question of the day, guys. Voluntary movement. That's the key. Coordination. All right, we got 14 answers. We got more people. Come on. 20 seconds left. Pick your answer. Process of elimination. You know this. You're looking for voluntary movement. Where does it come from? Balance, coordination, and physical movement. Motor skills. Well done. All right, let's break this down just in case. Hippocampus. Somebody give me what the hippocampus do.
A big-headed hippo on campus, memory.
Absolutely. Perfect.
To long-term memory.
Yes, so a big hippo in a campus, right? So memory, long-term to short-term, short-term to long-term. Yes, absolutely. Hypothalamus. What the hypothalamus do?
That's gonna be a thermostat for the body.
Yes.
Regulation, eat regulation, appetite,
What the heck, right? Water,
everything.
all the things, sex, temperature, and it goes on. So amygdala is the fear, not the stress, fear, and the smells. Smelling the oatmeal cookies from your grandma 30 years ago, it kind of brings you back that memory of the oatmeal cookie, right? Cerebellum, the drunk guy, he drunk, his cerebellum is affected, he has a lack of a coordination. Cerebellum, it's coordination. C and C. Coordination equal to cerebellum. All right? So this was today's event. We got a little bit more left over, but Joe, good job there, 3rd place. Benz, you got the 2nd. And number 1 here today is all right, Sully, you took home the key. So good job. We got here Price and Caitlin. Good job, everyone. I am so happy that we met today. And now it doesn't matter if you took the 1st place or not, right? What really matters is that you participated. So you participated and that you are here and that you are learning, right? So let me get off the camera here. So now the question is, Was this helpful to you? Yes or no?
Yes.
This
Yes.
was excellent. Thank you.
Excellent.
Yes.
Very good. So,
Helpful.
and this is what we do in our course. We try to break it down by everything. Everything you need to know is there. So all you gotta do is really go see the modules and understand. If you don't, all you have to do is reach to us, myself, and other senior students via the WhatsApp. We'll follow you through every step of the way. Few things first. Every time you accomplish a video, you get points. Those points let me know where you are in the process of your learning. So I can come to you. Some of you guys receive my emails saying, hey, you've been gone for a while. What's going on? Right? Because I don't want to lose you anywhere from your start to the end of this process. So keep in touch, keep asking, being curious of something that you don't know. And I wish you nothing less than extreme success. We do have a very, very, very high 99% plus passing rate. If you don't pass the first time, it's okay. We'll be here and we'll help you pass this test no matter what. Okay. So, what questions can I answer to you or be of service to you?
Thank you so much. Thank you. Working hard.
Yes, absolutely.